I'm going to show you a simple technique I like to do for patients that are having that radiating symptoms down their legs, also known as sciatica or a radiculopathy off the lumbar spine. Maybe it's coming from over in the glute. This is a really simple technique, and I have patients do this at home in between sessions, typically in high volumes as they can tolerate. So there are conditions where you would not do this, and I'll go over a few of those in a second, but you're going to put your hands behind your back, just in the small of your back here, right? And what I'm going to do, just get my feet what feels nice and comfortable, and then I'm just going to lean back, okay? And I'm just going to come back to the midline. And I'm going to lean back and come back to midline and center here, just nice and simple. And I would maybe do that for, maybe the patient can only tolerate 2 or 3 repetitions. So I would have them do 2 or 3 repetitions every hour, every couple of hours, and as much as possible. We're trying to see if that pain or those symptoms down the legs start to what's called centralize, or kind of move into the back and come out of the legs. And there are conditions where you wouldn't do that. In cases a lot of times with severe arthritis, or at least I wouldn't do that. Severe arthritis, you could have what's called listhesis, depending on the direction, what grade it is, that one vertebrae is shifted on the other. And I also, with cases of stenosis, especially severe stenosis, I would not do that particular movement. It would be, in my opinion, a little counterproductive. But I just have patients, hands behind the back, and just lean back as far as they can. And eventually you work towards leaning farther back, but initially it may be you only can move just a little bit. And I like to use the hands because you can push inwards on the hands. You can push forwards a little bit, and it gives almost like a little support and a little bit of that input to the joints by pushing forwards. And you can also do this using a towel, which I'm going to demonstrate right now. So we're going to use this blanket or towel if you have a towel at home. I'm putting it behind my back here in the low back. I'm taking both sides. Again, I'm going to stand feet nice and stable. I'm going to lean back, and when I lean back, I'm pulling this towel forwards and up, almost like I'm encouraging that curvature in my lumbar spine. And again, I'm going to do that initially. Maybe you only can do a couple of repetitions, and you're going to work towards maybe 10, 12, 15 repetitions as frequent throughout the day that you can. Now, if this does exacerbate your symptoms, and sometimes it's okay to exacerbate initially, but if that exacerbation continues, it just keeps getting worse, and obviously you want to stop doing that exercise, that movement, and don't do that. Which, of course, just like all of my videos, all this information is for educational purposes only and entertainment purposes. Don't do anything until you talk to your doctor or your medical provider. Again, thanks for watching.